And welcome back. I'm Mabel Jong. This is continuing coverage of the World Healthcare Congress in Washington, D.C. Thank you so much for joining us. Our next guest is an expert in patient safety, and he is here in our studio right now. He is Dr. Peter Pronovost, and Chief Clinical Transformation Officer at University Hospital Systems in Cleveland. Thank you so much for your time, Peter.
Thanks for having me here, Mabel.
Now, you have been talking about patient safety for a long, long time. You did big studies on this. Have you seen any improvements, or really people listening to what you said when you did the study?
Yeah, Mabel, the field is both hopeful and humbling. It's hopeful that we've had real progress, especially in reducing hospital infections. They still occur, but for example, these catheter infections that used to kill more people than breast or prostate cancer, if you can believe that, are down now about 85 or 90% across the country. So that's really encouraging. The other types of harm, the results are a little mixed. Some of the improvements are less, they may be real. Many of the improvements, though, Mabel, are simply that we code conditions differently because we've created economic incentives to not pay for them. And we're talking about safety in a lot more, but what I think we need to evolve from is safety as kind of whack-a-mole, where we focus on 1,000 different projects of what's wrong, and safety more as a disciplined management and operating system where we work to eliminate all types of harms.
Is it somewhat ironic that at a hospital, you would think that it is a clean place and that people are very concerned about that, but yet people die all the time from uncleanliness in the hospital?
Yeah, Mabel, you're spot on. And people care, the clinicians care deeply. They all, or by far the most people go into healthcare to help and certainly not to harm people. But we work in complex systems, and healthcare has evolved as more of an apprenticeship rather than an engineering mindset. So if you say, well, what's the difference between aviation or the nuclear industry and healthcare? Those started out of engineering to design safety into the system. Healthcare started as an apprenticeship, right? A doctor practices in their craft, or a nurse practices in the hospital. The administration isn't engineers, it's generally business people who provide the hotel functions, right? You get a bed and a meal and maybe some staff, and then the clinicians do their thing. Yeah. And so I think we evolved in two different cultures. We're starting to see more of this engineering mindset, but we have a ways to go still.
You've outlined it a little bit that there are impediments to this being done better, but what are some of the most obvious things that can be fixed?
Mabel, I think the most powerful thing to fix are the stories we tell. You see, narrative or story is the most potent force for change in the world because it defines how we act. Stories like JFK, I want a man on the moon, right? And whether we see each other as competitor or collaborators, in healthcare, we still tell the narrative that harm is inevitable rather than preventable. That when you care for sick patients or old or very young, sometimes people will be harmed, and they are. And when I think about what really was the transformation in the work that I was involved in reducing infections, and we interviewed clinicians, what we found, it really wasn't a checklist. It was they told a new story. The doctors and the nurses started saying these infections are inevitable, and they changed to these are preventable, and I am powerful to do something about it. And when you change that narrative, Mabel, everything gets better. They'll figure it out.
Okay, but is there certain things that can be done, just basic things, protocols, that maybe some hospitals aren't putting in place?
Yeah, without a doubt, there's a number of things we can do. One is what I call reducing mindless variation and augmenting mindful variation. That is, there's an absence of protocols, or what we might call standard work. How do you do things? How do you clean a room? How do you put a catheter in? And that needs to be standardized. At the same time, we also need to recognize that you differ than other patients. So there's times I may need to differ for you if I'm giving you the best care for you. Right now, we're grossly under-standardized, but we need to find that balance. Mm-hmm. We need to engage every employee in this work. I visited an aircraft carrier, and I was asking the gentleman sweeping the deck what job he does. And on the safety hierarchy, he's equal to the admiral. but on the power hierarchy, he's way below the admiral. And when I asked him that question, he stopped what he was doing. He looked me in the eye, tall and proud, and said, "I help planes take off and land safely to serve the mission of the United States." I then asked the woman who cleans the hospital rooms. Same dynamic. Safety really important, because if the room's not clean, you can get MRSA or C. diff and these bad infections. What job she does? And she looked away almost shameful and said, "I clean the rooms." And I said, no, you prevent infections. You save lives. And I think the healthcare culture has to be evolved, that every one of our employees is connected to the sacred purpose that we have and really sees themselves as preventing harm. And that's a role that leaders have to create, that kind of culture.
Would you feel safe staying in one of our hospitals today, Peter?
It's a mixed bag. I would almost certainly want to have someone with me to watch out, because things happen.
Okay. And any last takeaways you want to leave for our audience before we let you go this hour?
Yeah, for the audience, I think, Mabel, that this is a tractable problem, and each of us could do something every day to try to make it a little better, even if it's just a warm smile to your colleague, thanking them for the job they do.
Right. Thank you. Such a pleasure to speak with you.
Likewise, thank you.
And I'm Mabel Jong. Stay with us. We have much more to come.